Hi, Leslie Batson, your host of Black.Wealth.Empowerment. This is part two of my discussion with Dr. Cyd Charisse Williams, practices functional medicine in Orlando, Florida. And in the first part, you'll hear we're talking about the lack of vitamin D in our diet, which is one of the major causes why we have a lot of chronic illness in the Black community. Um, we discussed some other things in part one. So if you have not watched that, I encourage you to watch part one first and then come back to this video. This is part two of the discussion. So without further ado, let's listen to the rest of what Dr. Williams has to say. Thank you for listening. Okay. So what are the foods? What are the things that we should be eating? How should we be getting vitamin D into our system?
Okay. So some of the things that we can do ourselves for control is now foods, right? We want to eat fresh vegetables, fruits, clean meats. We don't want fried food, right? So some of your high vitamin D foods are fatty fishes, salmon, things like that, eggs, right? A lot of dairy products are fortified with vitamin D, but not everyone can tolerate dairy products, and that's a whole different discussion
Okay.
regarding, but they are fortified in vitamin D. So that's really important. And if I have nutritious foods, my body is going to absorb those foods and I'm going to get the vitamin D that I need as well. And we talked about if I have deficient nutrition, I don't even get the passive vitamin D from the sun. Other vitamins that are very important are vitamin B. There are 12 B vitamins. There are vitamin C, zinc, vitamin A, iron. All of those things are are nutrients that are necessary to the body for proper function and very important in addition to vitamin D. But we know that for our population, vitamin D is one of the nutrients that we know that we are likely, and actually vitamin D is actually a hormone, but it's one of those vitamins that we may be deficient in. And I think when you look at everything vitamin D controls, I think we really have to consider supplementing with vitamin D. And the literature talks about how vitamin D controls chronic illness, helps improve chronic illness. So taking a vitamin D supplementation, obviously getting a vitamin D level is important because then you find out how deficient you are. And then when you supplement, you can measure again and say, hey, I've corrected that imbalance. But you also have to think, wow, my skin color doesn't change. So I may need to continue with my vitamin D supplementation if my diet is not adequate, right? So maybe 1 year you say, oh, I'm deficient. I took my vitamin D and you corrected it. That's not going to hold you through to the next year. Does that make sense?
Right. Yeah.
So you have to keep monitoring and see what's going on. And then also chronic disease wise, if you take nutrients such as say a vitamin D or something that your body actually needs to run on versus, so people will say, hey, vitamin D supplementation is expensive. Pharmaceutical drugs are expensive, right? So people are spending unbelievable amounts of money on pharmaceutical drugs to treat symptoms where our community has to focus on, hey, let's prevent so that we don't have to take those expensive drugs. The cost of vitamin D is far less than heart medication, hypertension medication, and all of those things. If we improve magnesium is associated with high blood pressure. So if you are magnesium deficient, you may notice your blood pressure goes down if you're taking adequate amounts of magnesium. So there are multiple different factors that we can go into, but we don't have time to go into in detail, but other factors that can affect chronic illness that we need to look at, looking for more of the prevention side.
Right. No, it's so good. And I think, that's like you said, that could be a whole nother topic is the whole like pharmaceutical side of it. But yes, I mean, there's so many prescriptions, in our community, like you said, whether it's high blood pressure or, all those different things. And when you're taking those, I mean, I'm no doctor, but when you're taking those extra medicines, okay, yes, it's addressing that one particular symptom, but then you're basically adding all these toxins into your system. If you're taking these pills over several years or several decades, I mean, what is that doing to your system, right? It just seems like let's try to be more proactive, or at least now that we understand that vitamin D supplements is one way to try to address some of these conditions. let's try to, improve our nutrition, but also get the right supplements, which leads me to my next question, because we were talking about, multivitamins and how we can take it. And, um, you had made a comment about if you're able to just kind of go to a certain store and, buy a huge jar of a vitamin, it doesn't necessarily have the same quality of nutrients as some of these other supplements. So can you talk a little bit about, where we can get some of these supplements, in addition to our foods?
Absolutely. So the other controversy is with supplementation, right? If you watch the news, they'll say, oh, multivitamins don't help and they don't work. And on one hand, they're correct, because most of the multivitamins that people buy don't have anything in them. It's a bunch of filler and very little nutritious things in them. So of
Mm-hmm.
course, that's not going to work, right? So in the supplement industry, what's in the bottle doesn't have to be what's on the label, and what's on the label doesn't have to be what's in the on the bottle, in the bottle. So that's where it gets a little bit hard sometimes to find good quality supplements. And that's where I was saying that, hey, if I can go and get a 90-day supply of, say, CoQ10, and it's 90-day supply and it costs me $30, and everywhere else it costs $70, then you know that it's probably not a whole lot of CoQ10 in there, or it's very, very minimal amount, right?
Right.
And so what also is the problem, if you're taking supplements that are full of fillers, those fillers also stress your liver. And so a lot of people, I've had a lot of patients where we have found nutrient deficiencies and we have said, okay, we're going to take this deficiency, we're going to take something to get rid of this deficiency, and it works great. And then later they come back for follow-up and their liver enzymes are up and their numbers are down. And we try to figure out what happened. And then they admit, oh, well, those were so expensive. I was able to find, this much, 90, I was able to find 90 tablets for $30. So I've been taking those. And it was obvious by their blood work that what they thought was in the bottle was not in there,
Mm-hmm.
right? And so that can be a little bit tricky. I'm not going to lie,
Yeah.
that can be tricky.
Mm-hmm.
But when you look at actually supplying something to your body that your body actually uses, your body knows what to do. You don't tell your bladder to fill, your eyes to see, your heart to beat. It just happens. So we can impair function or enhance function. And that's the goal, is enhancing function with what the body needs nutritiously, and see if it can operate like we know that it can, and prevent as much as we can, rather than taking a pharmaceutical drug. Do you know,
Mm-hmm.
well, you tell me, Leslie, what is the average number of drugs the average 60-year-old is taking? The average number of pills a 60-year-old is taking?
Um, 5? I have no idea. I don't know.
The average 60-year-old is on 10 medications. Pharmaceutical,
10?
10. 10 medications. I've had patients on 20, 25 medications, right? So that's the
25?
problem with the system, right? I take this pharmaceutical drug for this symptom, but then it gives me another symptom. So you give me another pill to handle the side effects from this pill, but none of it, but the patient doesn't have any vitamin D. They're taking hypertension, heart disease, but there is no basis. It's like building a house. You have to have a good foundation and your substructure, right?
Yep.
Your
Yep.
materials have to be good, and you have to have a good foundation and materials so that you can build. And it's the same
Yes.
thing with the body, right?
Yes.
And that's what I want to get across, is that prevention is the key. And so regarding this virus, everyone is scared to death, right? So what
Right.
does fear do? Fear increases stress hormones, which decrease our immune system,
Right. Right.
right?
Right.
So so we take it one day at a time, and we say, what can we do? Which is what you're doing. You're listening to this podcast because you want to find out, what can I do for myself? And
Right.
this is one of those things. So when you have more control than you think, when you say, okay, I'm in control of transmitting this disease and getting this disease, I my immune system is the main issue. So now I need to learn how to control and improve my immune system.
Mm-hmm.
That's what we're doing, right?
Absolutely. Yep.
That is the key to this whole virus, because there will be another one.
Yeah.
There will be another one. And
Yep.
in general, just improving the health of the African American community as a whole, and of course everyone as a whole,
Right.
is important, because now we can see what the underlying issues are that are causing the increased infection rates and fatality rates in our community.
Absolutely. Yep. Nope. You hit it. You hit the nail right on the head. And it's the same analogy I use when it comes to their finances, right? If you don't have a strong foundation, it can all crumble, right? So this is
Absolutely.
exactly it. When it comes to your health, you have to make sure that you have that baseline, and it's got to be fortified. So I think that this was really great information, Dr. Cyd, because there's just, I just feel like there's so many things that we believed just from mainstream media or just our own understanding throughout the years, whether it was just get some sun and you'll get some vitamin D. We didn't understand that vitamin D was even something that, affected our immune system. So now we know that. We know we need to start eating the right foods. And I will try to include a list of some of these foods and items that you just mentioned, so that people can get their little grocery list together, right? And also, I think that it's important for people to understand, and I think we've all kind of heard it from time to time, but to understand that you just go to your favorite store and grab a multivitamin that's on sale. It does not mean that you're actually getting the quality of nutrients and vitamins that you believe that you're getting. So if you're seeing, certain symptoms or conditions persist and you've been taking some supplements or vitamins and it's not working, you might want to take a look at those ingredients and maybe try, a better quality supplement. It might cost a little bit more money, but you have to think of that. It might cost you a little bit less upfront as opposed to the cost and the toll on your body and your wallet years later when this condition has had a chance to manifest and grow. So
Yeah. So I like to pick brands that are, and a lot of them are physician only, meaning that they want to go through physicians, because what they don't want to do is have their brand on the shelf watered down, with regular vitamins that they know don't have actual nutrition in them, or the actual what's on the labels not in the bottle, and vice versa. And so a lot of those companies, when you're in functional medicine, we have particular companies that we use that can get you more quality products. And I also wanted to say that during this time, we talked about how fear decreases immune system, right, and stress. Let's take this time to focus on your health, prioritize your health. Let's not just survive this, let's thrive through it. And that's the key, is we want to thrive by doing what we can, spending more time with our families. I love seeing neighbors that I didn't even know I had walking, riding bikes with their entire family, right? You gotta ride the bike, don't forget the helmets, okay?
Right. Yes. Safety first.
Gotta say that. So you wanna thrive during this time period, and that's where you realize I have some modicum of control. I can do something, and that's the key that keeps the fear away. The other thing I neglected to mention was sleep. So as a whole, sleep is one of those things that a lot of people could use a little bit more of, right? So sleep is our brain and body's maintenance. So if I am not sleeping, if I'm not getting adequate sleep, again, that stress hormone goes up, and then my immune system goes down, right? So there are multiple things that we can do to kind of help our systems stay strong and recover, and then build up as we go along, so that we don't pick up COVID or any other new germ that comes along, right?
Right. Yep.
So start that exercise program that you've been saying that you're going to do. Right now, it's never too late, right? So even if you say, you know what, I know my nutrition is terrible, it's okay. Never too late to start. Just start making those changes. Slowly change your palate, change one new thing a week, and just take it a day at a time, and eventually get yourself and your whole family with better health. And I think that outcome is going to be better for the African American community as a whole.
Absolutely. And I'll just tack on to that now that we literally all are stuck in our homes, right? I hope people are eating out and ordering out less. So
Absolutely.
they should be, this is your time to experiment with new recipes, right? I know in some places it's still kind of hard to get some fresh groceries, that kind of thing. But if you can, do some research, right? Like I said, I'm going to provide a list with some of the foods that Dr. Cyd Charisse has just mentioned. Try to get some of those in while you're here. Start cooking up these meals together as a family while you're home over these weeks, or whatever it is. But just try to experiment with these different foods and see, just slowly start to introduce them into your diet, and hopefully it will become habitual. And hopefully your system will then start to prefer that over the processed and sugary foods that you've been eating. I mean, I know I'm guilty. I'm not judging anybody because I love sugar, but I definitely am, actually in this time I bought an air fryer, which I know that you said everyone should have, and I bought an Instapot so that I can start cooking more meals. Because my problem is I don't want to spend the time cooking. But both of these things, I think, help to speed up the process of cooking, and they help it to be healthier. So I know I am, trying to experiment with new recipes. And so I guess I encourage those of you watching this to also try to do the same. Try to get some of these foods that maybe you don't eat all the time, or try to eat more of them, and understand that it's not just for tasting good, but it's for that nutritional value.
Absolutely. In fact, there are so many, this is probably a topic for another session, is foods, right?
Right. Yeah.
Should you eat vegetable oils? Absolutely not. Vegetable oils are not good for you, right?
Right.
So those types of topics, we want olive oils over vegetable oils. We don't want to, you don't want to eat fried foods in vegetable oils. Vegetable oils become trans fats when they're heated, right?
Oh,
So
see, okay, that's going to be a whole separate, we're going to have
yes,
to record a whole separate video for that
yes,
one.
have a lot of vegetable oils. So that's a
Mm,
topic. I know you're going to
yeah.
make a list of things that we talked about. We
Yes.
haven't even touched
Right.
on
We've just scratched the surface. So,
threads.
this is good. This is a good introduction that I can kind of introduce Dr. Cyd Charisse, because, like I said, this is a really important topic, health, that I believe not just for the Black community, really for everybody, but this content was specifically geared towards our community. And I really think it's important for us to have this fuller, more holistic understanding of some of these things. And I feel like that's what Dr. Charisse does. That Dr. Charisse does is she helps us understand the whys. Like, if someone's just telling you, well, just you got to have more vitamin D, but it's like, why? I think if we all understand why some of these things are important to our bodies, then we'll be more intentional about, taking actions that take care of our health. So,
Absolutely.
okay. So on that note, I guess I will wrap up this discussion. I really thank you so much, Dr. Cyd Charisse, because this, I feel like, is super critical information. Um, you hear so much chatter about, why is this affecting the Black community? Why is it affecting the Black community? Well, there's several different reasons, but this is one critical reason. We know that vitamin D can address a low immune system, right, or poor immune system, and this is one area that we can actually take control. So thank you so much for sharing your expertise.
You're welcome.
And we will definitely be chatting again on our whole series of other topics that we definitely want to have you cover for us.
Excellent. I look forward to it.
Okay, thank you. Take care.
Bye.
Okay, bye bye.